I'm Roy Robertson. This is San Diego Made San Diego Proud, where we present the organizations dedicated to improving lives of people in America's finest city. Dr. Jordan Siegel joins us here this morning. Dr. Siegel is a prosthetic urologist at Scripps Health in La Jolla who specializes in the treatment of men's health issues, including the topic we're discussing today, erectile dysfunction or ED. Dr. Siegel will tell us about some of the advances and options in managing this condition and some of the other health-related issues that could be a concern for patients with ED. Dr. Siegel, welcome. It's interesting because we think about ED in one way, but there are so many different health-related concerns. Primarily, there could be indications of heart problems with ED.
That's true. One of the important things with erectile dysfunction is it could be the first indicator of cardiovascular disease, what we call silent cardiovascular disease, no symptoms of chest pain, shortness of breath that we typically see with cardiovascular disease. So it's really important for somebody with erectile dysfunction to get checked out by their primary care cardiologist, make sure there's no underlying cardiovascular disease.
I mean, it really is kind of a complex condition that can affect your life in so many different ways other than issues with intimacy.
Absolutely. We always think about the effects, the psychological effects of ED,
Right.
the confidence, but the effect in a relationship, not having the confidence to perform during those intimate moments, that's an important part as well as all the health concerns.
Yeah, and it's important to kind of take the stigma off it. I would imagine there's still some avoidance, some reluctance to come in, but once you come in, get informed, I mean, you're really on a track for better health and better intimacy.
Right. It's definitely a sensitive topic,
Sure.
but it's a topic that is easily addressed, and all the evidence out there shows that the quality of life for these patients, once they get the erectile dysfunction treated, improves significantly.
Okay. Walk us through that process then. So a patient decides, yes, I do need to address this. I want to come in. Typically what happens on a first visit with the evaluation, the assessment?
Sure. We'll go over all the medical history, do a full physical exam, and then generally most patients' first-line therapy will be the oral medications, your
Right.
Viagras, your Cialis, Levitras, and try those out, see if they have good results with it, which we see in about 2/3 of patients.
Okay.
And
if that doesn't work, then it's on to other options, including
injection therapy and the penile implant, which is a very common procedure that
Right.
we do for patients.
And you said it's a very quick and easy process. 30 minutes surgically, a few days to recover?
Right, yeah. Most high volume implanters will have about 30 minutes for the case. It's outpatient surgery, so you go home later that day or the next morning, recovery within about 3 to 4 weeks. And excellent results for both the patient
Yeah.
satisfaction and their partner.
I was going to ask, what's the feedback that you get from your patients once they've maybe dealt with this for a number of years and then suddenly they've got a cure, right?
Right, yeah. I mean, it's a sort of a new day for them once they have this usable erection. Their confidence, their lifestyle improves significantly, and oftentimes when the partners come in, they're as happy as anybody.
Right, and again, it's the consequences not only of the intimacy, but in a broader sense, potentially an indicator that there might be some underlying causes such as heart disease, diabetes, et cetera.
Right, and that's one of the most important things with getting evaluated for ED. Make sure you don't have those risk factors or have underlying disease such as poorly controlled diabetes or something more significant like cardiovascular disease.
Okay, you can schedule an appointment to talk to Dr. Siegel and learn more by calling 858-529-5351, 858-529-5351. Get a lot more information by going to the website edcure.org. That's edcure.org.